And so here's a free lesson for anyone that claims that the governments of the world are not, let alone have incentives to inflate COVID-19 death counts. For anyone that claims that they are not actively inflating death counts is simply severely mis or disinformed and are absolutely not following the science or trusting the experts, or doing their homework, or knowing how to follow the science or trust the experts. Because if we go to Public Health Ontario, Enhanced Epidemiological Summary of COVID-19 Case Fatality, Case Identification, and Attack Rates in Ontario, we find directly from their own words, and increasing the number of reported deaths in each age group by 50%, except for age groups that had no reported deaths. Increasing the number of reported deaths in each age group by 50%. Reported deaths were inflated to assess the impact of potential underdetection of COVID-19 deaths. An inflation factor of 50% was chosen, since on average several European countries reported underdetections of 50% in an analysis conducted by the New York Times. And in this New York Times analysis, so who are these New York Times public health experts informing Canada's government public health policy of why they should inflate death counts by 50%? Well, they're not public health experts, scientists, or any qualified expert whatsoever. In fact, Jin Wu, author of the New York Times analysis, has 0 credentials listed in his bio. I apologize, it's a female. Jin Wu was apologize, I don't want to misgender her, so please forgive me. Please don't cancel me and send me to jail and fine me $200,000 for misgendering. I apologize, Jin. Whatever your gender is, please forgive me. Jin Wu was a visual editor and reporter based in Hong Kong, leading the New York Times graphics coverage in Asia between 2018 and 2020. She previously worked at Reuters in Singapore. She is not a public health expert or a scientist or a professor of anything. She is not an expert in anything whatsoever. Another author of the New York Times study that told the Canada public health government to inflate COVID death counts by 50% is Alison McCann, who is a reporter and graphics editor on the international desk. Here are the people telling the Public Health Canada to inflate death counts by 50%. She is based in London. Elian Peltier is a breaking news reporter in the London bureau of the New York Times. He joined the Paris bureau in the summer of 2017 as a reporter after covering the French presidential election of 2017 as a freelancer. So he is a news reporter who has about 3 years of experience and is telling the Public Health Government of Canada to inflate COVID death counts by 50%. New York Times reporters of 3 years experience are telling Public Health Canada to inflate death counts by 50%. The only he focused on daily news in France and enterprise stories about immigration, social issues, and sports.
Is also that many people who were not even involved in public health took the role of public health professionals. We saw the major newspapers and media really flooded with people who had no clue about public health, let alone evidence and research methods.
Mr. Peltier graduated from Sciences Po University in Paris with a dual master's degree in journalism and international security. That qualifies him to tell Government Health Canada to inflate death counts by 50%, doesn't it? The only type of somewhat credible professional here would be Josh Katz, who is Josh Katz is a graphics editor for the New York Times, where he covers politics, sports, and culture for the Upshot. This is the man telling Public Health Canada to inflate COVID-19 death counts by 50%. He is the author of Speaking American, How Y'all Use and You Guys Talk, a visual exploration of American regional dialectics, Houghton Mifflin Harcourt. He studied political science philosophy and earned his master's degree in statistics. At least he has some experience in statistics, although maybe he should stick with politics and sports and culture, rather than telling the Public Health Canada to inflate COVID death counts by 50%. Don't you guys think? Wouldn't you agree? This is not public health. Listen to the science, aka the political science. Egregious examples in the media that I've seen of anti-science came from this email that I received from the Daily Yahoo News that with the title headline, "These 13 states need to lock down immediately according to Harvard coronavirus experts." A new article by Yahoo infers that Harvard coronavirus experts demand that everyone lock down immediately and essentially vote left for Black Lives Matter in order to save lives. And who was the author of this article where they cite the Harvard coronavirus experts of this Yahoo News article? Danielle Allen, the director of Harvard's SAFRA Center. "We also collectively need to keep focused on what should be our main target, a path to near zero case incidence of coronavirus." And here's your Harvard coronavirus expert. Danielle Susan Allen is an American classicist and political scientist. She is the James Bryant Conant University professor at Harvard University, where she is also the director of the Edmund J. Safra Center for Ethics. There's your coronavirus expert, a political for Black Lives Matter, claiming that we need to lock down in order to completely eliminate coronavirus from existence. Oh my God.
I think many people, leaders, politicians, policymakers, but also scientists in this pandemic showed that they had no clue how unreliable modeling is. They just took these numbers at face value. They looked at the plots. They had very nice colors and they looked very scary. And they just said, well, this is science. No, this is not science. This is in COVID-19, media and even more social media really took control of science to a large extent. And that's very unfortunate because these are people who are not trained most of the time to really cover science. We've seen a deficit of science journalism even in the past. There were very few journalists who knew about science.
My name is Cullen Smith. This is Lifting the Veil. You can find all of my full books, presentations, videos, films, articles, posts at patreon.com/liftingtheveil. And there is also a ton of exclusive content, and I will leave the cited reference links in the description down below. So you can check that out for all of my full content, and I will see you guys in the next video. I rely solely on word of mouth, and the recommended algorithms are not recommending any of my videos or films anymore. My channel has literally been completely restricted, so I rely on your help by sharing my work around if you appreciate it, and leave me your comments. I definitely want to know what you have to share and what you have to think about all of this stuff, and I will see you in the next video.